So my name is Jessica Crowe. I am a program manager within the Office of Patient Experience. I manage enterprise-wide initiatives around patient experience, and I also work with the Center for Excellence in Healthcare Communication, which is a team that's been developing and delivering communication skills training to clinicians across the enterprise as well as outside of Cleveland Clinic. We focus on communication and empathy and just seeing people as people, right? And just having a real conversation, getting to know who they are, understanding their needs, what's important to them, their family, their background, so that you can truly figure out how to care for the entire person. Time is always an issue within communication in medicine. You know, I think whatever we do, the feedback we always hear is, well, I don't have any time, right? I don't have time for that. I have to see more patients, right? Or I don't have time to go to a class, or, you know, I don't have time for this. And I think that if we were to use some of the skills that we're trying to have people focus on, it actually saves you time, right? But I think that time's always a barrier. I think productivity, there's always an ask to do more and more with less and less, faster, right? So I think we're constantly trying to compete with that, and I feel like what gets lost at times is that real connection and seeing people as people, and it gets very robotic and monotonous and emotionless and cold. Empathy to me, not a textbook definition, right? So when I hear it, what I think of is somebody hearing me, somebody understanding what I'm going through, somebody almost feeling what I'm feeling, and being able to recognize that in that moment for me, not about themselves, not about anything else, but really just thinking about what I am going through at that time and how that must feel, or what's going on with me, because I think that you get that genuine response in that moment and feel that they're actually listening to me, they actually understand how I'm feeling, and that they care.
Hello, good.
I care about education. I care about sharing information. I care about others. I care about our patients, our colleagues, caregivers, staff, everyone. So my name is Joaquin Dos Reis. I work for Cleveland Clinic Global Education, and we are here representing patient experience. Empathy means everything. If you are a Cleveland Clinic caregiver, from the first time that you park your car and you are in Cleveland Clinic, you are a Cleveland Clinic caregiver, and part of that we have the opportunity to work with patients and work with colleagues and physicians from all over the world. So we kind of connect the dots. We bring international physicians to Cleveland Clinic to meet our physicians and leaders.
So my name is Julie Risch, and I work at the Cleveland Clinic and the Office of Patient Experience. I think medicine is inherently human. The art of medicine without relationships, we're not just technicians. And providing excellent patient experience is about meeting people in a very relational human way. Optimal healing can occur without the humanity of medicine, without a true understanding of another person sitting in front of you, without being able to empathize with their experience. I think relationships are healing in and of themselves. And so when we're connecting as people, it's healing to me as a clinician, but it's also healing to the person that's sitting in front of me. So I think there's a lot of barriers that equal time and task pressure, right? That how can I be present in this moment? And not thinking, 3 steps ahead or 3 steps behind, but just to be present in the moment. And yet when you do that, you can find meaning and purpose in your work. So I think the barrier is, how do we overcome those obstacles to create moments of presence and being mindful and truly connecting on a human level, because that's where we can find restoration and purpose and get back to why you chose this profession, this career, this entity in the first place.
Technological wonders need now to be incorporated, as physicians had done for these 2 millennia, into a system of practice and care that shares the responsibility for the care, to the extent possible, with the patient and the family. And I think it's not so far away. It's not so difficult for us to figure out how to do that, as long as this is an accepted goal of the entire system, with each health system contributing to it to the best that they can.
To patient journey, patient experiences, that's the impetus for Empathy at Health. It's also, part of that was influenced by what's going on here at the conference, Patient Experience Conference. Dr. Adrian Boise has been preaching this for quite some time, long before Empathy at Health came along. So curating content from that site into ours would be great. And other industry leaders and folks on Twitter that have really contributed to the dialogue as well. There's Empathy Princess on Twitter, Maram, and there's so many people on Twitter, even today, the whole Pink Socks movement, and tweet chats about this. So it's a great platform to just people voice their opinions, their frustrations, and best practices, and maybe we can gather some of that and put that collaboratively or collectively on Empathy at Health as a resource.
Well, I think the empathy, for me, the important part of this conference is what I talked about in that second victim. And these are healthcare workers that are involved in an adverse event. And the empathy that needs to be expressed to them is that connection of realizing that they've been in a difficult situation and they need to be supported and they need to be reassured and they need to know that they went into medicine for the right reasons. They take care of patients because they love what they do. And they should continue to have that fire in their eye when they go to work every day, to be totally engaged. We know that total engagement leads to less errors, so we want our workforce to be engaged.
We did a research on empathy, compassion, all these kind of things. We actually asked consumers to what extent was empathy and compassion important to them. And I was actually surprised. It came down the list. And I think it's because, again, empathy is a healthcare-centric language, right? A typical patient or family member out there knows what they want to see. They want to feel listened to. They want to feel like they're being spoken with in a way they understand. Those were the things they elevated in terms of importance. So, for me, the lens is not to get stuck in what empathy is in so much, so not to push back at the question, but you know what I'm saying? But to think about what does it look like in action. Probably less concerned about how we define empathy and elevate empathy, and really about the actions we take to ensure that patients and family members and those that are delivering care feel heard, that are communicated to effectively, are engaged in ways that matter to them. Then I think they feel what we believe empathy is, all of those things, without having to put a label on it in a way that is about us doing something, but more so about engaging the folks in care themselves.
My name is Pfarr, and I am from Pittsburgh. Patient experience, I have found, is one of those things that no matter who you are, what walk of life you come from, when you're speaking to people, they all have a patient story. Everybody has a patient story, whether they were a patient or whether they were caring for a patient. Everybody has a healthcare experience that most often is not necessarily a good one, and I think that is very, very telling. But I think that healthcare has the opportunity to really take care of these people and to turn a negative situation into a very, very positive one.
My name's Peskin. I'm originally from Cleveland. Empathy is something that's absolutely essential in us being human beings. It's the idea to look at our fellow man and woman and see pain or unhappiness or suffering and feel that yourself, and to be able to truly feel what someone else is going through. And it's different than sympathy. It's not just feeling bad for someone else for what they're going through. Empathy is truly experiencing or attempting to experience what the other people are feeling. We improve the patient experience by, as much as it's a cliche, recognizing that everyone is patients at one time or another, and even if you're not the patient sitting in the hospital bed, you're the family member standing next to it with your loved one there. You improve the patient experience by taking the physician off a pedestal. Physicians should not be autonomous decision makers anymore without any input from patients and family members.
conference when my nurse stood right by my side and made physical contact with me during my biopsy. It was so comforting and reduced my anxiety. Thank you. A UCS staff security guard let me lie down on the couch to rest and even dimmed the lights for me. Something my doctor did was said that comforted me. This gave me a hug. Again, these are often recalled years later. The receptionist moved another appointment by 10 minutes so that I could have my very first appointment after diagnosis with the surgeon.